For more on this story, we're now joined by Lerato Mthunzi, General Secretary of Health and Allied Workers Indaba Trade Union. And they join us now on the line. Lerato, thank you so much for your time this evening here in SABC News. I mean, firstly, let's just talk about this shocking and very disturbing story coming out from Ga-Chuene, where two women were attacked. How do you react as the trade union?
All right, from my side, it's quite faint, but I think I'll try and go.
All right, can you hear me, Lerato?
From afar, but I can make up what you're saying, yeah. Yeah,
I was just saying, I mean, it's really quite a shocking and sad story coming out from Limpopo. Of course, this ordeal taking place during a Thursday night where these two women were attacked and raped. As the Indaba Trade Union, how do you react, to this incident coming out from Limpopo?
Look, from our end, we're not shocked. I mean, in 2023, which was our third march to the Limpopo Department of Health, we had warned the then MEC, Popira Matuba, that the clinics that she is envisaging to do 24-hour services are literally a death trap for healthcare workers because there was no security. And we said that boldly because we knew that the security personnel that they put there, they don't even have batons, no pepper spray, not even backup support or even patrolling police around this facility. So, to be honest, I think this is one of the most gross incidents that we've came to learn. But in the past, not only in Limpopo, this occurrence of attacks of healthcare workers, rape of healthcare workers, assault and all that has actually been happening.
And would you say that this is then a security issue, or would you say that this is just purely criminal activity? But
look,
yeah, you can continue.
Criminal elements will always target soft targets. In this instance, if the clinic was properly secured, it was safe for women to actually work in it for 24 hours. It would have diverted them. It would have made them less interested in going to the clinic. But the clinic, almost everywhere, we are soft targets, and this is where they come in, they rob the patients, they rob the nurses, and like I'm saying, this is the worst one where a person even goes to the length of dragging women to a field to actually rape them.
And on average, Lerato, do we know how many security personnel are being deployed, particularly for clinics, that operate on a 24-hour basis? Because with this one, we understand that there was also security on the premises.
Definitely. For this one, there was security, but there was only 2 security personnel, which one of them was a female. And I think what I'm trying to drive home is the fact that even the security guards themselves, when they see danger, they run for their lives because they really cannot secure the clinics or the hospitals because they are not armed. They also don't have any weapons to actually defend themselves first before they can even defend the healthcare workers or defend the patients. In many a time, this shortage of security guards is as equivalent as the shortage of healthcare personnel in our hospitals. They can even put one person. If you are lucky, it will be 3 or 4 people. One is patrolling the perimeter. The 2 are standing there. But the question is, even when the criminals are approaching with guns, what is the poor security woman or man going to do?
And what does this then say about government's efforts, to ensure that services do reach the people on a 24-hour basis? I mean, the fact that we have a clinic operating for 24 hours, clearly there is a need for it.
Definitely, 24-hour operations is not what we are against. What we are against is unsafe areas, unsafe health institutions for healthcare workers. The responsibility of the government or the employer is merely to make the environment to be safe and secure. The services then can benefit the communities. What the government is failing is to take responsibility in hiring correct security personnel. All of the Limpopo security guards are outsourced, meaning that it's private security guards. Government is not doing the checks and balances as to whether they are CERA compliant. They can actually just pick anyone that doesn't even have any security certificate and put them at the gate. That's basically what this tender process has done. As opposed to the past when we had security that are employed, trained, developed, curated, audited by the government, it was a different ball game altogether.
And maybe, I don't know, Lerato, if you have maybe spoken to or reached out to these two nurses, do we know the kind of state they are in? I also understand that they are still traumatized by the ordeal.
Absolutely. I think it would definitely not be an opportune time for us to just try and, want to get the story itself. The story, we're getting it from the third parties, from their colleagues, and around the community around the place. I think, to be honest, I can only imagine what they are currently going through. Obviously, there is no confidentiality here. People have already put two and two together. They know who are these nurses. Their names are not secured at all. And I can imagine what their families, leaving your children, your husband, going to work only to come back being a victim of assault and rape can never be an easy thing. So I cannot even begin to imagine what they're going through.
And what do you have to say to the government in Limpopo when it comes to, ensuring that, healthcare practitioners are safe at all times, and particularly at, clinics and hospitals in the province?
I think Limpopo is the worst province when it comes to health and leadership. It is now even worse that the person that was the MEC of health, Popular Matua, is now the premier. The level of arrogance that you get from this political personnel, it's unmatched. They don't care. They actually have bullied. We have statistics of even the numbers of healthcare workers that went on strike to just address this issue, even the issue of off-duties that were putting them in danger, which most of them were dismissed, and some of them were actually threatened and victimized.
All right, Lerato, thank you so much for that insight. That is Lerato Mthunzi. She's the General Secretary of Health and Allied Workers Union, Indaba Trade Union, talking about those two nurses who were attacked on Thursday night in Ga-Chuene at a clinic in Limpopo.